10 key reasons why coronavirus transmission is primarily airborne. If transmission is airborne, public health measures would need to take into account. Since last year, several studies have found that coronavirus SARS-CoV-2 spreads mainly through the air. Yet there have also been other studies, including a recent one funded by World Health Organization, that have found the evidence inconclusive. And now a new team of experts looked at the available research and published their assessment in the Lancet that there is strong, consistent evidence that the primary transmission route of SARS-CoV-2 is indeed airborne. What are the implications of the assessment? If transmission is airborne, a public health measure would need to take into account measures that focus solely on large droplet airborne transmission, but fail to treat the virus as predominantly airborne would leave people unprotected. We need to place less emphasis on deep cleaning and repeated hand washing, but still follow the basic hygiene measures, of course. Dr. Trisha Greenhalgh of the University of Oxford, lead author of the paper, told in Indian Express by email. We need to put ventilation from and center, example opening windows, carbon dioxide monitors, air filtration when necessary, better fitting masks from worn whenever indoors, and attention to what the Japanese call the 3 C's: avoid close contact, crowded places, and closed spaces. Poorly ventilated. How did the experts reach the conclusion? Reviewing existing research, the 6 experts from the UK, US, Canada identified 10 streams of evidence that collectively support the hypothesis that SARS-CoV-2 primarily transmits through airborne. Superspreading events account for substantial SARS-CoV-2 transmission. Indeed, authors wrote, such events may be pandemic primary drivers. Detailed analysis of human behaviors and other variables in concerts, cruise ships, etc. have shown patterns consistent with airborne spread of SARS-CoV-2 that cannot be adequately explained by droplets. Long range transmission of SARS-CoV-2 between people in adjacent rooms has been documented in quarantine hotels, but never in each other's presence. Asymptomatic or pre-symptomatic transmission from people who are not coughing or sneezing is likely to account for at least a third and perhaps up to 59% of all transmission globally, and is a key way SARS-CoV-2 has spread around the world, indicating a predominantly airborne mode of transmission. Transmission of SARS-CoV-2 is higher indoors than outdoors and is substantially reduced by indoor ventilation. Both observations support a predominantly airborne route of transmission, the authors wrote. New infections have been documented in healthcare organizations where there have been strict contact and droplet precautions and use of PPE designed to protect against droplet but not aerosol exposure. Viable SARS-CoV-2 has been detected in the air. In laboratory experiments, SARS-CoV-2 stayed infectious in the air for about 3 hours. In one study, viable SARS-CoV-2 was identified in air samples from rooms occupied by COVID-19 patients in the absence of aerosol generating procedures. In another study, it was detected in air samples from an infected person's car. SARS-CoV-2 has been identified in air filters and building ducts in hospitals with COVID-19 patients. Such locations could be reached only by aerosols. Studies involving infected caged animals that were connected to separately caged in uninfected animals via an air duct has shown transmission of SARS-CoV-2 that can be adequately explained only by aerosols. 1. No study to our knowledge, the authors wrote, has provided strong or consistent evidence to refute the hypothesis of airborne SARS-CoV-2 transmission. Some people have avoided SARS-CoV-2 infection when they have shared air with infected people, but this situation could be explained by a combination of factors, including variation in the amount of viral shedding between infectious individuals and different environmental conditions. There is limited evidence to support other dominant routes of transmission, that is respiratory droplet or fomite. Since all this is from existing research? Wasn't it already known? Thank you.